Mental health crisis in education. Students suffering in silence. Mental health in education overview. The mental well being of students is critically impacted by academic stress, societal expectations, and the challenges of adolescence. Academic stress, societal expectations, and the challenges faced with being a young child in today's society all greatly impact a student's mental health. Mental health issues among students saw a rise after the pandemic and continues to impact the success of students today. According to the reporting done by Matthew Stone of Education Week, 42% of high school students in 2021 reported feeling sad or hopeless for at least 2 consecutive weeks in the previous year that they stopped engaging in their usual activities. Up from 26% in 2009, girls and LGBTQ+ young people are particularly likely to report those feelings. Thoughts of suicide, suicide attempts, and actual suicide amongst young people have also risen in that period, with Black children nearly 2 times more likely than their white peers to die by suicide. According to the U.S. Centers for Disease Control and Prevention's Biennial Youth Risk Behavior Survey and CDC statistics, depression and anxiety among young people, by some measures, doubled as the COVID-19 pandemic dragged on. Should schools focus on academics or mental health? Some critics say schools should focus on academics and leave mental health to parents, while others argue that schools are the most accessible and least stigmatizing place for mental health support. Many parents feel as though schools have overstepped when it comes to speaking with their children about their mental health, while many on the other side of the debate say students who do not have access to mental health services could potentially benefit from help received from school counselors. Some critics say schools should focus on academics and, as one Texas group put it, leave mental health and parenting to parents. Many in the GOP appear to share that view. Just 44% of Republicans who voted in the midterms said it was very important for schools to provide more mental health services, compared with 82% of Democrats, according to a November survey. How much should schools be involved in mental health services? Schools' involvement in a child's mental health has been a polarizing topic amongst parents, as many parents feel as though their child's school should only involve themselves in matters that pertain to education. What many parents with this viewpoint fail to realize is that schools providing mental health positively impacts education outcomes. According to the CDC.gov, schools that promote student mental health and well-being can improve classroom behavior, school engagement, and peer relationships. These factors are connected directly to academic success. Should students have mental health days off from school? Some say that allowing students to take mental health days off from school will allow for better academic performance. According to the American Psychological Association, research discovered that stress impacts memory and cognitive skills, which are crucial for learning. Encouraging children to take breaks will help their brain functions better when they return to the classroom. Schools should not be involved. Opposing viewpoint. It is widely debated how much involvement schools should have on a child's mental health and how they should speak to them about it. In a paper published last year, two research psychologists at the University of Oxford, Dr. Lucy Folks, argues that school systems should proceed cautiously with large-scale mental health interventions. It is not that we need to go back to square one, but it's that we need to press pause and reroute potentially. Dr. Folks says. Folks suggest that awareness campaigns of mental health were causing an increase in mental health disorder reporting. While some argue that schools should be less involved, the majority agree that far more urgent problem is lack of access to treatment. About 60% of young Americans with severe depression receive no treatment, according to Mental Health America, a nonprofit research group. In crisis, desperate families fall back on emergency rooms, where teens often remain for days before a psychiatric bed opens up. There is good reason to embrace a preventative approach, teaching school children basic skills that might forestall crisis later, experts say. My personal perspective. When a child is suffering in silence, it is extremely hard to learn. I personally have chosen this topic of mental health because personally throughout my years in middle and high school, I dealt with severe anxiety. As someone who always strived for perfection, taking tests and receiving grades in school gave me grave anxiety. I realized over time that the pressure that I was placing on myself was doing more harm than good. Mental health among students should be a priority and resource to help children who struggle day to day. If students' mental health is not being taken care of, then they cannot live up to their full potential. My goal as an educator will be to care for a child's academic and mental health.